It's a Northwest lifestyle weekend on Como News. IRG's Health Talk continues.
All right, our next guest, Dr. David Ibrahim, an orthopedic surgeon for the Polyclinic. And this is a sign of just how things are going these days with advancements in technology. Robotic-assisted total knee replacement. This is pretty fascinating.
Yeah, it's fascinating stuff, the technology and the advancements in technology. Now, remember, people, the robot is not doing the surgery. The physician is doing the surgery. The robot is enhancing the technique and the procedure.
Okay, so there's not somebody in there that you're just saying, hey, remove that bone.
We're not to the Jetsons yet, okay? We're close, but the Jetsons are still 2 years out.
All right, here's Shannon O'Kelley and Dr. David Ibrahim.
Dr. Ibrahim, welcome to Health Talk. How are you?
Good, how are you? Thanks for having me.
Thanks for joining us. I always like to kind of get started by talking about kind of your practice. You're an orthopedic surgeon. You have a fellowship in total joints. You work at the Polyclinic, but how'd this all happen? Give us a little background. I always like to call it the day in the life of Dr. Ibrahim. And where'd your interest come in orthopedics? I mean, a lot of times people have some kind of exposure to an injury or they're active. And tell us about your life.
Yeah, that's a good question. So my interest actually started back in college. I went to
total
USC.
Hips and knees. Well, I mean, that's a great story.
Team training a lot. So
excellent
a lot of the
experience.
injuries that happened
where'd you do
there.
your fellowship?
Got my interest in medicine, I'd say, in general from there. And then as I went to medical school, I was trying to hone my skills and trying to figure out exactly what I wanted to do. I knew I wanted to do something surgical. I think surgery, they always say, if you're going into something surgical, right away, just because, one, you just need to do something with your hands and you like instant gratification results because you like to see patients improve. So as I went through medical school, orthopedics just kind of fell into my lap in the sense of, I started doing rotations and I saw the improvements that you can make in people's lives and functionality. So that's really where my interest in orthopedics came. And then as I went through residency, I started exploring the different, subspecialties, and then total joints was something that just really spoke to me in terms of, it's basically rebuilding things. You're just basically reconstructing joints, letting people get back into work and get into action, and I could incorporate as well the fracture care that I actually found very interesting as well. So I found that total joint replacements kind of combines both of those aspects. So that's where really the total joint aspect of things came in. And then as I, obviously subspecialty trained, as you said, so as I kind of looked forward to my practice, I knew, okay, I need to incorporate the total joint aspect of things as well as the fracture care. So that's where the general orthopedic care comes in as well into my practice. So a day in the life really consists of focusing on hip and knee reconstruction. So that's partial knees, total hips, and then also being able to do general orthopedics. So that includes fracture care, some sports, some upper extremity. Fortunately, I'm able to partake in a practice where there's a lot of subspecialty trained orthopedic surgeons. So we tend to focus on our niche, and but mostly for me, it's the total hips and knees.
Yeah, total hips and knees. Well, I mean, that's a great story. I mean, excellent experience. I mean, where'd you do your fellowship?
So I did it at a place called Florida Orthopedic Institute in Tampa, Florida. Fortunately, was able to be taught by some of the world-renowned mentors in total joints. A lot of the folks who participate in product designs as well as robotics. So that's also where my interest in robotic surgery came about. It was an integral part of our fellowship. So it was a great opportunity and experience overall.
Yeah, and tell our listeners, I mean, I think it's important that they understand, when you talk about a fellowship, this is a year-long, intensive practice and caring for patients just with total joints. These are hips and knees, using robotics, greatest and latest techniques in technology and also hardware. Tell us about that fellowship and how much you learn in a year.
Yeah, exactly. So I guess you can consider it hyper learning.
Yeah,
because
that's right.
In a sense, everyone goes through regular old orthopedic residency, and then you basically become interested in one subset of orthopedics, and then you try to hone your skills and really just focus in depth about that one area. So a subspecialty, or a fellowship as you might hear it called, is really just focusing on that one aspect of orthopedic surgery, just basically learning all the sort of nuances of that one specialty, so that when you get out, you're very extra trained per se in that one aspect of orthopedics. So for me, it's total joints. Others might choose, say, spine or sports, and that's where really your practice will be driven to.
Right. Medicine has changed so much and is changing daily. I'm going to take you back 30 some years ago when I first came out of physical therapy school. my first job was at a hospital, and total hips and total knees, it was fairly new. These things were being done, and they weren't doing them on people that were under 60, and a lot of times that patient stayed in the hospital 2 to 3 days. We're going to come back in a minute here. We're going to talk about technology advancements, robotics, and some of the stuff that's going on in total joints that's just fantastic.
That sounds good.
We'll continue our conversation on robotic-assisted total knee replacement right after this time out on Como.
It's a Northwest Lifestyle Weekend on Como News. Now back to IRG's Health Talk.
All right, we continue our conversation on robotic-assisted total knee replacement. Dr. David Ibrahim and Shannon O'Kelley.
Dr. Ibrahim, again, thanks for joining us on Health Talk. We were talking a little bit about just the technology and the sophistication advancements in total joints, particularly hips and knees. Tell us about what you've seen and how you're using that technology in your practice to enhance the recovery time.
Yeah, that's a great question. We always say for those of us who use robotics, I think medicine was one of the later sort of adopters of technology. You look at a lot of things in life now that are sort of automated. The one thing I want to say about robotics is, it's a common misconception. Like patients will come in and say, wait, so a robot's doing my surgery? What's going on here? So the thing there is the robot is helping us do the surgery. It's not sort of autopilot. We program it. It does a surgery, and then you're sitting back, relaxing while the robot's doing all the work. The robot, in a sense, is just a tool that we use. It's a nice way for us to get a 3D reconstruction of the patient's anatomy even before walking into the OR. So we do a limited scan before. It gives us a mapping really of the patient's joint. That allows us to improve implant positioning, kind of come up with a game plan even before we walk in the operating room. So that has tremendously improved our ability to kind of personalize, implants and the surgery to the patient. It also kind of gives you a sense of confidence. You kind of know what you're getting into. It's a roadmap before you even walk in. The other nice thing is that it improves the precision and accuracy of our bone cuts, which in total joints, particularly in knees, is really critical because that influences implant positioning. So that's huge. The other thing too as well, there's more long-term data that's needed, but the short-term and sort of mid-term data that we have so far on robotics and the outcomes is that it's improving patient satisfaction, potentially improving patient outcome scores. It's potentially decreasing the amount of post-operative pain, which equates to patients leaving the hospital faster. And there's an argument to be made that maybe it's leading to less revisions over time with implants that are put in with robotic assistance. So, it has great potential. I think it's kind of a house divided. Some of the more traditionalists, of course, are saying, why do you need this technology? And I don't think that you're ever going to maybe necessarily replace kind of what we've done over the years and decades with robotics, but I think it's a nice tool to have in particularly maybe complex cases. So, it's expanding the world of total joints quite readily.
It's amazing stuff. Again, thank you for really describing that, because I think a lot of patients do feel like, well, a robot's doing my surgery. No, you're in control of the robot. The robot is giving you as a surgeon kind of a 3D map, kind of topography, so you have accuracy in your surgical technique, which better placement, better outcomes, better patient satisfaction. You hit it all on the head. Is there certain people that maybe just the robot doesn't work? Can you do something like when you're doing a knee revision and there's already an implant in there and you're taking the old implant out and putting the new one in? Can you use the robot, or is that freehand for you?
So that in general, that's generally freehand. The robot is not really FDA approved at this time for revision procedures, just because, we're still learning more about it and the applications are expanding. It might be in the coming years, but for now, usually it's primary replacements. That applies to, say, partial knees, total hips. But for the revision scenario, there's still more work to be done on that avenue.
Wow, that's great information. Dr. Ibrahim, thank you so much for joining us.
Thanks for having me.
Fascinating topic. Dr. David Ibrahim, you can get in touch with him at polyclinic.com to get more information. Robotic-assisted total knee replacement. As you mentioned at the top, Shannon, it's not a robot doing the surgery, but an assisted surgery from that robot, but they're becoming more and more prevalent.
Yeah, it's like a topography of your joint, allowing for increased accuracy and intervention. Outcomes are great.
All right, we'll have our next guest, Andrew Golden, right after this on Como.